What if your most intimate years are still ahead of you? If you've been avoiding intimacy because of performance concerns, or if it's been months or years since you've been close with your partner, you need to hear this. According to the Massachusetts Male Aging Study, 52% of men between 40 and 70 experience some degree of erectile dysfunction. That means if you're struggling, you're in the majority, not the minority. You're not broken, you're not alone, and it's not too late to fix this. In the next 10 minutes, I'm going to break the silence on rebuilding intimacy after 50. Let's start with the facts that nobody wants to discuss. The Cleveland Clinic's 2023 research shows that ED affects 40% of men at age 40. And that number increases by 10% each decade. What that means for you, by age 70, nearly 70% of men experience some form of ED. You're not the exception, you're the rule. For premature ejaculation, the Journal of Sexual Medicine found that 31% of American men aged 18 to 59 report PE symptoms, with the highest rates in men over 50. Translation: if you're finishing too quickly, 3 out of 10 men your age are dealing with the exact same thing. But here's where it gets more concerning. If you have diabetes, your risk skyrockets. A 2022 study in diabetes care found that 75% of men with diabetes experience erectile dysfunction. That's nearly 3 times the rate of men without diabetes. In plain English, if you're diabetic and having problems, it's probably not in your head, it's in your blood sugar. The same study showed that men with diabetes are 50% more likely to experience premature ejaculation. But here's what these studies also show. Most of this is treatable. The real damage isn't just physical, it's emotional. One man told researchers he hadn't touched his wife in 5 years because he was too ashamed to admit what was happening. The moment he finally spoke up, their relationship changed overnight. Maybe that sounds familiar. You start avoiding intimacy altogether because you're afraid of disappointing your partner. You make excuses, you create distance, you convince yourself it doesn't matter anymore. If you're married, your partner starts feeling rejected, unwanted, confused about what changed. If you're divorced and dating, you avoid relationships entirely because you're terrified of that moment when things get intimate. You tell yourself you're too old for this, that this part of your life is over. But intimacy isn't just about performance, it's about connection, touch, closeness, feeling desired and desirable. And that doesn't have an expiration date. If this conversation is long overdue, give this video a like and subscribe. We're the only channel having honest conversations about the real challenges men face over 50. Before we talk solutions, you need to understand what's working against you. The American Diabetes Association 2023 guidelines confirm that diabetes damages the blood vessels and nerves crucial for sexual function. What that means, if your blood sugar is out of control, everything else will be too. High blood pressure medications, especially beta blockers and diuretics, cause ED in 25 to 30% of men, according to the American Heart Association. Translation: the pills keeping you alive may also be affecting your sex life. But don't stop taking them. Talk to your doctor about alternatives. The Journal of Clinical Psychiatry reports that SSRIs, that's antidepressants like Prozac, Zoloft, cause sexual side effects in up to 70% of patients. In real terms, if you're on antidepressants, there's a high chance your medication is the reason things feel off in the bedroom. Low testosterone affects 40% of men over 45, according to the American Neurological Association. What this means? If you have no energy, no desire, and no performance, it might be hormonal, not mental. If you're married in a long-term relationship, rebuilding intimacy starts with one thing: communication. Have the conversation you've been avoiding. Tell your partner what you're experiencing. Research from the Kinsey Institute shows that couples who communicate openly about sexual issues have 40% higher satisfaction rates. What that means in practice? The conversation you're dreading might be the one that saves your relationship. Most partners are more understanding and supportive than you expect. They want to help, not judge. Start with non-sexual intimacy. Touch without pressure. Massage, cuddling, kissing without it having to lead anywhere. Redefine what intimacy means. It's not just intercourse, it's connection, pleasure, closeness. Consider couples therapy or sex therapy. The American Association of Sexuality Educators report 85% success rates for couples who seek professional help. Bottom line, professional help works. Don't suffer in silence when solutions exist. If you're divorced or single and thinking about dating, the fear is real. What if I can't perform? What if she's disappointed? What if I embarrass myself? Here's the truth. The right person will be patient and understanding. Don't lead your insecurities. Don't hide them forever either. When the time feels right, have an honest conversation. Most mature women understand that intimacy at our age is different. Focus on building connections first. Physical intimacy is better when there's trust and communication. Consider addressing medical issues before you start dating seriously. It will give you confidence. And remember, confidence in intimacy spills over into confidence in life. From how you carry yourself to how you show up in relationships. You have decades of life experience, emotional maturity, and wisdom that younger men don't have. That's attractive. Rebuilding intimacy is part of reinventing your life after 50. If you want a comprehensive guide to navigating all aspects of this transition, download my Reinvention Guide After 50 using the link below in the description. Now let's talk about evidence-based solutions. For ED, the New England Journal of Medicine confirms that PDE5 inhibitors, that's Viagra, Cialis, Levitra, are effective for 70 to 80% of men, including those with diabetes. Think of these medications like jumper cables. They don't fix the battery, but they get the engine running. And they work for 7 out of 10 men. For PE, the International Journal of Impotence Research shows that topical treatments and certain medications can increase time to ejaculation by 300 to 500%. In plain terms, you could go from 30 seconds to 5 minutes with the right treatment. Testosterone replacement therapy helps when levels are clinically low. The Endocrine Society's guidance shows significant improvement in 60 to 70% of appropriate candidates. Translation: if your testosterone is actually low, replacement therapy works for most men. But you need proper medical supervision. Talk to your doctor about medication side effects. Sometimes switching medications can completely solve the problem. Think of it like changing the oil in your car. Sometimes a simple adjustment makes everything run smoother. The best thing you can do for your sexual health is improve your overall health. Studies show 30 minutes of walking daily can reduce ED risks by 41%. What that means? A simple daily walk could cut your chances of problems nearly in half. For strength training, research shows 15 to 20% increases in testosterone in men who lift weights regularly. That could be as simple as picking up a pair of dumbbells twice a week. Nothing fancy, just consistent movement. Stop smoking. It reduces blood flow by up to 40%. Limit alcohol. More than 2 drinks daily increase ED risk by 25%. Bottom line, what's bad for your heart is bad for your sex life. Get quality sleep. Men who sleep less than 5 hours nightly have 15% lower testosterone. Simple math. Better sleep equals better performance. Here's what I want you to remember. The shame and silence around these issues causes more damage than the issues themselves. The research is clear. Most problems are treatable with the right approach and professional help. You deserve to feel desired and desirable at any age, whether you're rebuilding with a long-term partner or starting fresh with someone new. It's possible. Don't let fear or embarrassment rob you of this important part of life. Take the first step. Talk to your doctor. Talk to your partner. Talk to a therapist. This isn't the end of your intimate life. It's the beginning of a new one. Cheers.